Is there actually a cure for interstitial cystitis? If you've been dealing with this for a while, you probably already know something frustrating. The recovery rate within the traditional medical system is very low. Many doctors focus on managing symptoms, and in some cases, they don't have any real treatment options at all. But there is another approach, one that many people are never told about, and one that often leads to significantly better results. It's called Pain Reprocessing Therapy, and it takes a completely different approach. Now, before you click off thinking, my symptoms are physical, so I need a physical treatment, just stay with me for a couple of minutes because what I'm about to explain might completely change how you see your symptoms. Back in the 1970s, a doctor named John Sarno began questioning how chronic back pain was being treated. At the time, many patients were undergoing surgeries, but the recovery rates were surprisingly low. So he started looking deeper. What he found was unexpected. Many of his patients didn't have a clear structural issue that explained their pain. Instead, he believed the pain was being driven by the brain, a response to stress, repressed emotions, internal pressure. He called this condition tension myositis syndrome, or TMS. Instead of focusing on the body, he helped patients understand what was happening in their brain. He encouraged them to reduce fear, address emotional stress, shift their attention away from symptoms. And many of them recovered even after years of chronic pain. Over time, these ideas were expanded and refined. Modern researchers and clinicians developed what is now called Pain Reprocessing Therapy. It builds on Sarno's work, but is more structured and evidence-based. And importantly, it's not just used for back pain. It's now being applied to a wide range of chronic symptoms. The pattern seen in people with interstitial cystitis is very similar. Low recovery rates, unclear physical causes, symptoms that persist despite treatment. At the same time, there are many people reporting recovery using mind-body approaches like this, often at much higher rates than traditional methods. The bladder and pelvic region are deeply connected to the nervous system. They constantly communicate with the brain, and that system is influenced by stress, fear, attention, emotions. So even though the symptoms feel physical, they may be driven by how the brain is processing signals. If you recognize yourself in some of these patterns, your symptoms started during a stressful period. You struggle with anxiety or chronic stress. You have perfectionist tendencies. You experience trauma or bullying growing up. You tend to suppress anger or emotions. Then there's a good chance this approach could help you. Pain reprocessing therapy doesn't mean your symptoms aren't real. It means they may be coming from a different place than you think. And for many people, understanding that is the first step toward recovery. I used to struggle with pelvic pain and constant urgency too. So I built Sanavita to help others recover. Sanavita includes psychological support using pain reprocessing and metacognitive therapy, guided stretches to relax the pelvic floor, expressive journaling to release built-up emotions, my recovery story and practical lessons for daily life, visualization meditations to calm your nervous system and ease symptoms. Track your symptoms, take assessments, and explore a full library of recovery resources. Download Sanavita today and start your recovery.